This is lab 24 on the cat specimen. So again, we're doing the eye and then some superficial veins of the head. And you're working on your left half of the head that you took out your zygomatic arch and reflected your temporalis muscle. And you're going to look for these eye structures that we're going to work on. So I have pulled out the jaw a little bit here, the mandible, and so you can see in this space. And you're going to reflect your, well, basically the orbital ligament is very short in a cat. So the orbit is the conical space that contains the eye. And the cat has more of a almost complete, it's nearly complete, bony orbit. And the dog had that really long orbital ligament. So in the cat, you may need to use rongeurs or something else to cut through this bony part of the orbit and reflect it up. And then I also reflect this part down there. So then you can see all of these areas. You're also going to cut the lateral commissure on your eye here, and then you can open that up even further. So underneath your orbital ligament and your orbit here, you're looking for the lacrimal gland, which is this flat, tannish, lobular tissue right here. And then we have the periorbita, which is the sheath of connective tissue that kind of covers over all these muscles back here, and it's this whitish sheet. And you're just going to open that up and incise it and open it up so that you can see all these muscles underneath. So reflect the periorbita. All right, so we're going to start again with the rectus muscle. So here on the lateral side, we have a lateral rectus muscle. And then we have, on the dorsal side, we have a dorsal rectus muscle. So that would be right here. I'll try and pull the eyeball out just a little bit. So dorsal rectus would be here. Lateral rectus is here. And then in between you have one of those fascicles of the retractor bulbi muscle. So the retractor bulbi is one muscle but has 4 fascicles, and they're in between in the spaces between the rectus muscles. So dorsal rectus, one of the fascicles of a retractor bulbi, lateral rectus. Then we're going to move ventrally here. And so you have a retractor bulbi fascicle here, and then here is the ventral rectus muscle right here. And also on the ventral view, you're going to look for your ventral oblique muscle, which comes up around the ventral side here. So ventral oblique muscle. And we'll move up to the dorsal aspect again and roll the eyeball out a little bit. So you're going to detach it here and then roll it laterally. So then we have, kind of sitting on top of the dorsal rectus here, is your levator palpebrae superioris. And I just ripped it. That's too bad. But it's right here, and it kind of sits right on top of that dorsal rectus and goes up a little further because it's going to the eyelid. So levator palpebrae superioris. And then if you roll this out even further, we'll get a look at the dorsal oblique. So dorsal oblique will be this one right here. And then that's going through that little cartilaginous plaque, the trochlea. So that's going to be right here. And again, it's more by feeling it. You palpate it, and it's hard. You can tell where that trochlea is. So that dorsal oblique passes through that. And then if we go a little more to the side here, we have a medial rectus muscle right there. So that dorsal oblique going across there, and then the medial rectus muscle right here. Okay, so moving on to the eyeball itself. So the bulbous oculi is the eyeball. And we're going to open it up just as we did in the dog with a really sharp scalpel blade or a small scissors, and make an incision here and then kind of make a pie wedge shape and cut that open like that. And once you open it, you'll be able to see some of the structures inside, but in the cat everything gets pretty tiny, so you won't be able to see everything, and you may want to look at a dog as well. And then the figures in the book that are helpful for this lab, 5-33 is helpful for the muscles that we just went over, and then 5-36 is helpful for the eye structures themselves. So here we have the external fibrous coat that we're looking at, and so we have the sclera is the white part here, the cornea here, and then the limbus is the junction between those, so the corneoscleral junction. And then when we cut it open and we open it up here, we can see a few of the internal structures here that are part of the middle vascular coat. So here we have the iris, so the colored part of the eye, and then the hole in the middle of the iris would be the pupil. And then the choroid is the continuation of that vascular coat. And so it's going to be kind of this black line you see right here, would be the choroid extending back. Then you would have the ciliary body, which is going to be kind of just behind the iris, in between the iris and the choroid, would be the ciliary body, this little nub right here. And that has the ciliary processes and then the zonular fibers, and that's the suspensory ligament for the lens, which we can see the lens right down in there. Kind of fell through there. The lens is right there. And so that would be suspended here by those zonular fibers. Then we have the internal coat is the retina, and it's kind of this grayish stuff you'll see kind of coming off here in the back. Right there. And then you'll also, in the back of the eye, called the fundus, so the posterior portion of the eye is called the fundus, and you're going to have the optic disc, and then that's where you can see the optic nerve. And we also see the tapetum lucidum, which is the reflective layer in the eyeball. So again, if you go to that figure 5-36, here would be the lens suspended by those zonular fibers connected to the ciliary processes. Ciliary body, the choroid is the black line. The sclera would be the outer layer here. The retina would be the inner layer. And then here's where we see the optic disc. And then the tapetum lucidum is number 1 in this diagram, so it's right here. And it would just be that reflective area you would see. And then the anterior and posterior chambers are evident on this diagram, and you can try and see them in your specimen also. So the anterior chamber would be here, so between the cornea and the iris. The posterior chamber between the iris and the lens, so here. And those two are filled with aqueous humor, which is what came out of the eye when you incised it. And then we also have the vitreous chamber, so that will be back here, and that will be filled with the vitreous body, which is a little more gelatinous material. Okay, then we'll move on to the right side of the head, and we're just doing a few of the superficial veins of the head. So we're starting with external jugular vein here, and external jugular will then have maxillary vein here, and linguofacial vein right here. So then linguofacial vein will have the lingual vein here, and then facial vein we're going to follow up and across the cheek here. So facial vein going up, and be very careful in this area. You have to keep these nerves for the next lab, so be very careful along here following that facial vein. And in the cat, it loses its injection here, and it gets very small. So here, the facial vein continues up, and we're going to see it break into those two branches that we saw in the dog, just not as well defined. So here we would have the dorsal nasal going up towards the nose here, and then we would have this angularis oculi vein right here going up towards the eye. And that should be it for lab 24.